Next question, is the QRS complex narrow or is it wide? In this example, you can see skinny complexes, which means less than 120 milliseconds. And 120 milliseconds would be 3 small boxes wide. In this one, you can see some wide QRS complexes, which are 120 milliseconds wide or more. So again, 3 small boxes. And this one would be a wide complex tachycardia. The reason why we use these simplistic terms, narrow and wide, is because we treat them differently. If the patient was unstable, they were short of breath, hypertensive, they'd actually get shocked anyway. But if not, then you might use different techniques, different medications, depending on whether it was narrow or wide. For example, if a patient with atrial fibrillation and a rapid ventricular response, you might try a beta blocker. But in a patient with wide complex tachycardia, you wouldn't try a beta blocker because this patient might have an accessory pathway, which we'll get into in a later video, and a beta blocker could decrease the conduction through the AV node and worsen the arrhythmia. The reason why the narrow complex is a narrow complex is because the impulse travels down the fast conduction system, down through the AV node, through the His bundle and the fast conducting Purkinje fibers. So what we see on the trace is a rapid depolarization of the ventricles using this network of fast acting fibers. In the case of a wide complex tachycardia, in a ventricular tachycardia for example, the source of the impulse is in the ventricles. Maybe we have an abnormal focus within the ventricles that's firing off. So these cells have fired and sent out an impulse, but the impulse isn't connected with a fast-acting conduction system. So the impulse will travel to the other cells in the ventricles by cell-to-cell conduction, which is slow conduction. On the trace, we're going to see a wider and a slower QRS. There is another option when we have a wide QRS, and that's when we have the slowing of the conduction through the bundles and the fascicles, which are components of the fast conduction system. This would be either called a bundle branch block or a fascicular block, but again, we'll come to that in the future.